Hi, good morning. My name is Brandy Miller, and you are now listening to Torch Talk. Today we have with us Miss Janet Sims. Hi, how are you?
I'm great. Thank you for having me today.
Yes, thank you for coming. So, can you give us a brief description about who you are and what you do here at Richmond CC?
Yes, I'm the Dean of Allied Health and Human Services, and right now I serve as the interim department chair for nursing. This simply means I lead and manage anything healthcare here at the college.
Okay, so what can students expect out of the Health and Sciences program?
So from our programs, the first thing you can expect is a rewarding career. We have many careers that you can do. You can start here and go anywhere with us. It does take a great deal of hard work, but it's very worth it at the end. We have to make sure that you're academically prepared to do the rigorous courses that we have within our healthcare programs, but our faculty are very good about supporting you in many different ways to try to help you reach your goals.
Okay, so can you explain the different allied health science programs that are being offered here at Richmond Community College?
All right, that's great. We'll start with dialysis, and that is the technician that works the machine that works as a kidney when they have kidney failure and their kidneys don't work. So these technicians work at places like DaVita Dialysis. They can work at the hospital. They have dialysis clinics there. It's a great job for people who are morning people because they start early in the morning, but it means that they rarely work weekends or holidays, which is great. We have the certified medical assisting. That's a 2-year program, so it's a degree program. Our dialysis is a 1-year program. So medical assisting is a 2-year program, and you can work in a doctor's office or in a lab. You can do the front of the house, what we call the front of the house, which is signing patients in, doing insurance, the paperwork in, coding and billing, or you can work the back of the house and work with the physicians, the nurse practitioners, or the PAs, and actually help with patient care. We have the Certified Nurse Aide program, and that is CNA 1 and CNA 2. You can work in the hospital, you can work in long-term care, but more importantly, you have to have that CNA to come into the RN program. So a lot of our students start right here at home in the CNA classes. We also have emergency medical science, which trains you to be a paramedic. The paramedic course is we have a 2-year degree program, or we have the work-based learning program that's a 2-year program. So that's a great program to join into. We have both nursing programs. We have an RN and an LPN. The difference is the RN works at a higher level than the LPN. Most LPNs work in doctor's offices. They are beginning to bring them into the hospital because of the lack of nurses. And then we have the RNs. We also have, on our workforce education side, we have pharmacy tech going on, and that's an exciting new program here at Richmond Community College. We actually will let you start the day after you call us. It's a competency-based education, so you can start and finish wherever it works for you.
Oh wow, that is great. Okay, so can you inform us on the different career opportunities that you can get with the different curriculums that you just informed us about?
Okay, so just to recap that, the programs that we have can put you working in the industry in facilities like hospitals, acute care. We can put you in long-term care where we take care of patients who have chronic illnesses. We can get you in jobs like at a pharmacy at the hospital or at Walgreens or Walmart. We can help you find a job in a dialysis center or in the hospital doing dialysis. And of course, the paramedics typically work within the emergency room or on a truck.
Okay. So, what are some of the challenges that you have seen the students face while completing their desired programs here at Richmond CC?
So the biggest problem we see is getting adjusted to the rigor of the courses. In our nursing program, for instance, you have to study about 30 hours a week at home without us. And so that's really hard to balance when you have a very active family life at home or you're trying to work a job. But all of our programs, we try very hard to remember that these are working individuals, they have families, and so we try really hard to give you some off days, but there's a lot of studying that's involved.
Okay, so I've been here for almost a year, and I have noticed that students who come from, the Grimsley building are always together. They eat together, they sit together. Would you say that they lean on each other for, like moral support?
Absolutely. Our groups of students, not only within the group that's like a first-year student or a second-year student, but what we see is that even the two classes come together. You will notice those who have Christian backgrounds, they will gather up in front of our Grimsley building. They get in a circle, hold hands, and they pray before their test because they want to give each other that support. They will team up and help another struggling classmate. They study together. So there's a lot of involvement, and what we see is even after they graduate, they remain very close. Many of our students say we come in as 80 strangers and we leave as a family.
Oh, no, that's nice. That's good.
Mm-hmm.
Okay, so what would you say is the most rewarding part of being the Dean of Allied Health and Human Services?
It is watching students meet their goals, and when I get to see them show off a bit at graduation, or like we're having our ADN pinning this week on Wednesday night, and to see our nurses dressed in their white, and they're so proud of the hard work. Seeing our certified medical assistants, they'll pin on Tuesday at 4 o'clock, so we'll all gather up and be proud of them and congratulate them.
Okay, so are the students from the Allied Health programs being recruited by local employers?
Yes, local facilities come in and actually they compete for our students. They'll bring food in, they'll bring gifts in, they talk to them, they send them emails. They actually, both of our hospitals have had our nursing students on their campus for a meal just so that they can get to know them. And when they're actually doing their clinicals, all of our students are actively recruited. Most of our dialysis students already have a job by their second semester.
Wow. So, would you say that this has been challenging or easy for students to find job placements after graduation from the different programs?
Very easy. As a general rule, our students have already secured a job before they ever graduate. So I don't ever remember a time that we've had students that could not find a job. So if you want to go to work, healthcare is the area to choose.
Okay, so is there any additional information that you would like to inform us about?
Yes, there is. A lot of people in the past have looked into our nursing program, but for one reason or another decided not to. And I want people to know that our admission process has changed now. Starting with the group that will be coming in 2023, we no longer require that TEAS test. It's an expensive test. It was kind of like an SAT, but we just didn't see a good correlation between our students and that test score. So now we have a program of study to help them build that strength. And so anyone who's interested in coming into the nursing program or interested in more information about it, they definitely should reach out to me. I'll be glad to meet with them, or they can go to Student Services and see Crystal Shaw, our counselor.
Okay. Well, Ms. Sims, this has been fun.
Well, I have had a wonderful time. You know I'm proud about our programs.
Yes. Well, thank you so much for coming on Torch Talk, and we will see you next time.
All right. Thank you.
You're welcome.